moonlight on the seashore. Wish you were here to love I something. Cause I'll be home. Bigger. Now, welcome everyone who is watching me from the other side. Welcome to Benjamin the Wise Guy. Everyone who is here. If you are a new one, I usually say drop in our chat. Tell us where you are from. Tell us where you are watching me from. Tell us where we are shining from. Tell us where you are watching me from. And when you are here, don't just be there. At least like the stream, and tell us where you're from. Today we are gonna do some things that are important, and we were talking about something that is called non-pharmacological management of bipolar. That is what we are going to do. Non-pharmacological management of bipolar disorders. Managing bipolar disorders. Jatin, hi sir, I'm back. Hi Jatin, how is you Jatin? Where are you chilling at, Mr. Jatin? Mr. Jatin, where are you chilling at? Are you in school today? I can see you here, Jatin. Are you in school today, or where are you chilling at? Tell us where you are, and tell us where you are me from. Today, hope you have some questions that are good. Okay. You are in school. Oh, nice. That's a nice one. You told me you have exams. You have exams that you are having. So today we are gonna talk about non-pharmacologic management of bipolar. Robert Ramos. Hi, Robert Ramos. Hey, that name is cute. Just imagine Roberta Ramos. Roberta Ramos. Hi. Where are you chilling at, Roberta? Are you in Mexico, South America, or North America? Your name is cute like you, Roberta. Hope you are okay. Jatin, nice. Thank you. Welcome. Today we want to talk about how to manage bipolar without drugs. Ohio, welcome. I know this is your first time here. I'm just logging in and you're here. So like Roberta, and give me your subscription. Subscribe to the channel and see what I'm doing in the channel. You can have many friends of yours, and you can meet some friends of yours here. I have so many followers that are from Ohio too. So welcome. Thanks for checking in. Hope you are cool. Here we talk about medical issues. We talk about issues concerning health, issues concerning the mental health, and also health as matters. Now, we have been talking about bipolar complications, and we want to talk about how to manage bipolar without medication. You know, there is a way you can manage bipolar situations without medication. And we have really talked more about problems concerning the brain. We have talked about what is called autism, ADHD. Those are called neurodevelopment complications. Those are called neurodevelopmental complications. So as we continue to finish about bipolar, because now when you have given someone drugs, you need to manage this person, symptoms, and even psychotherapy. Psychotherapy is very important. But I usually say, if you are here, you are a new person, and you are watching, please don't fail to give me a subscription and ask what we are doing here. And ask what we are doing here. Now, I can see new faces. That Roberta Ramos is from Ohio, and Roberta, Jatin is a student, a medical student. Hope you are. We like talking and knowing people and knowing friends. So, if you are okay, you can ask any question, any medical question that you have in this channel. You see, my channel is made of many medical things. So I'm just coming in and I'm welcoming people in, like Roberta and Jatina just here. Roberta is from Ohio, Jatin is from India. And if you have a channel, go to the chat, tell us too you have a channel, what do you do in your channel, you get, so that we create the big link. So whoever is watching, if you have not subscribed, please, you became my friend. Jatin is saying, Roberta, can you become my friend? So Roberta, tell Jatin if you can become the friend. Anyone who is new again, who is new, let's talk, let's interact at the chat. If you are watching me and you are new, the channel is called Benjamin the Wise Guy. I am Ben, Dr. Ben. Let's interact and get to know how to deal with some matters concerning health. Health is very important, and when health is very important, we need to take more of time on discussion of health. And we don't just talk about health here. We talk about very many things like mental health, social life, how to interact with some people, how we can live better in this life with other people, you get. And we continue. So let's interact. Today I'm talking about bipolar complications. How can we, but there was a question, let me see. There was a question that was asked today about metformin and diabetes. So before we continue, I think we answer that question. We answer that question before we go to bipolar complication. Metformin and diabetes. So anyone who has any question, you can ask any question that you have. This is a place where we talk, we socialize, and we were on mental health. We were discussing something called bipolar, and people say that Roberta, what do you do? Are you a medical student? No, you are not. What do you do at currently? If you are okay, you can answer. If you are not okay, we are okay. We are always careful with our questions. So anyone who is watching and you are new, this is Benjamin the Wise Guy, the doc himself. Habs is here. Habs, what are you doing? I want to discuss manage bipolar without drugs. Roberta, Habs. But we have new friends today. We have Roberta, but you remember our last friend Jatin, the medical student, is here. So welcome, my guys. Those are new that are here. Please like and subscribe, right? Because Doc needs your subscription to grow. The only thing you can do is to hit the subscription button and say, yes, I did it. You see? So welcome everyone. Welcome to the channel. Be free to ask any question that you feel is a medical question. You see, any question that you feel can help you in any way. So let me, before I continue how to manage bipolar without medication, what do we do? Let's answer the question. Let's answer this question before we continue. Before we continue, let's answer this question. What is metformin? Because many people that are diabetic, do you have WhatsApp? Yes, I have it. I have WhatsApp. You want my WhatsApp, Habs? I can give it to you. My number is always open. I receive so many medical texts to help. So this is my WhatsApp, 5407297604. Yes, that is my number. You can WhatsApp there. If you have any question, a private question, any private question, you can WhatsApp me there. Roberta, welcome. Roberta, I would like to know you more, like how I know. Blessings to you, Dr. Benjamin, and everyone in the house. Oh, Marwa live. So I just checked him because I'm going to shoot video. Yes, I know Uncle right now is the time where he's going to shoot a video. I have to go to bed. Oh, no problem, no problem. Roberta, subscribe and you are free to come in wherever you like. And if you have any medical question, you can ask me. No worries, no worries, Roberta. At least you are a new person and you are supporting. No, please wait, Roberta. Jatin don't want Roberta to go. Roberta, Jatin don't want you to go. Please ask Roberta what he needs. Jatin, you know, there are some friends of mine that I usually feel good when they are here, like Jatin. And there is another friend of ours from India who is a very funny guy. Drive safe. Now, Ben, my brother, hello, Margaret in Norway. Today we are having new friends, Margaret, and they are making me to smile. The new friends are making me to smile, like Jatin. Jatin, you know, is a cool guy. Jatin is a cool guy. He makes people laugh. So, before we continue, let's welcome the new people. Welcome. Roberta is a new subscriber. I thank you for subscribing wherever you are. I know you'll continue following us and being in this community. Big love from me, Dr. Ben. Big love from me, Dr. Ben. So, metformin and type 2 diabetes mellitus. What is metformin? Diabetes mellitus is a chronic disease whereby body cannot properly regulate blood sugars. Blood sugars are unregulated. So, you know, Roberta, are you a student? No, Roberta said she's not a student. Jatin, Roberta said she's not a student. Roberta, you are a student. Okay. I didn't see that. Which course do you do? Which field, or are you a student of a master's degree, a diploma, or high school, or let's get to know Roberta before she leaves. Roberta, tell us. Now, main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. So, type 1 diabetes is autoimmune destruction of pancreatic beta cells. Autoimmune destruction of pancreatic beta cells. That is type 1. So when your beta cells of the liver does not remove insulin, that is type 1 diabetes. You cannot do anything. You have to be given insulin. Usually begins in childhood or adolescence. Now, let's get to type 2 diabetes. Type 2 diabetes, most common type. Body becomes resistant to insulin because you like eating a lot, your body is bigger, so the insulin that is coming out is not helping at all, or it's less. Gestational diabetes, when you are, I got to go. Okay, Roberta, see you. Hope you have subscribed and you'll be back anytime, or you can be checking. If you have any medical question, Roberta, be free to ask me. I'm a cool guy. I relate, and you see everyone who is here is a cool person. Now, gestational diabetes is that one that you get when you are pregnant. When you are pregnant, and that is gestational diabetes. Now, what the main question of the house is this: what is metformin? What is metformin? Metformin is first line medication for type 2 diabetes. For type 2 diabetes, it belongs to biguanide class of drugs. How does it work? How does metformin work? Hope that person who asked this question will come in and listen to what we are saying. It works by lowering blood sugar mainly by decreasing glucose production in the liver. You know, when you have not eaten and you are hungry, in the liver, what happens is you produce glucose so that it can go to the bloodstream, you get energy. Because you had a store of glucagon. Glucagon is when your sugars are so high in your body, insulin is released, it changes the sugars to glucagon, they go to be stored in the liver and to the muscles. So that you can do what? You can use it when you have you are hungry. Now, the liver increases release glucose in the body. Metformin suppresses this. Metformin suppresses that. Increase insulin sensitivity. Body cells respond better to insulin. It makes body cells to respond better to insulin so that they can change more sugars into glucagon, which cannot affect you. You get? Yes? No, I went to get water. Oh, okay. Decreasing interstitial absorption of glucose. Increasing interstitial absorption of glucose. So that is how insulin, metformin works. But you know the side effects of metformin, that drug that I was asked at, it lowers blood glucose, reduces HbA1c, improve insulin resistance, reduce risk of diabetic complications, promotes mild weight loss and naturality. Weight loss and you become normal. You know, people that are diabetic, sometimes they have big bodies, but metformin makes it better that you reduce your weight. Yesterday we had a question about Ozempic. Ozempic is a drug used to people that have diabetes. People that have diabetes, you get Ozempic. Improve lipid profile slightly. That one was the question that was being asked. Now let's go and ask another question that we continue with how we can manage bipolar without drugs. There is a way we can manage bipolar without drugs. You see, very many ways we can manage bipolar without drugs. Okay, let's get to go. Let me get to going. How can we manage bipolar without drugs? Non-pharmacological management, treatment of other medications that help. Psycho-education. There is something called psycho-education. Psychology education. Psycho-education. It's very important. Teaching the patient and family about bipolar disorders. Teaching the patient and the family about bipolar disorders. It includes understanding symptoms of mania and depression. Understanding symptoms of mania and depression. Identifying triggers and warning signs. You identify what is triggering the bipolar complication. And then importance of treatment adherence. If you are bipolar and you are put in the drugs like fluoxetine and the others like lithium, mood stabilizers, you adhere to the medication so that your neurotransmitters are stabilized in the brain. Avoid alcohol and drugs. Alcohol gives people some symptoms of psychosis. You get? It gives people symptoms of psychosis and it's not good. So avoiding alcohol when you are bipolar is very important. Very important. Stress management. How you can manage stress. Because stress increases the release of dopamine and other things. You get? Stress management is very important. If you are bipolar and you have stress, it escalates because stress suppresses pleasure hormones. Stress makes dopamine not to come out and serotonin. And imagine you are bipolar. Hey, you can have hypomania. You can have hypomania, and hypomania is not a good thing. It gives someone depressive disorders. It gives someone depressive disorders. You imagine? So, my friends that are listening, psychoeducation to people that are bipolar is very important. And here we are not using drugs, my guys. Here we are just understanding symptoms of mania and depression, the ones that we talked about, and then identifying triggers and warning signs, identifying what triggers the problem and what warning signs come out of it. You get it? The other thing is importance of treatment adherence. You should treat these people to know the importance of treatment, and when it is time to take the medication, you take the medication. When it is time to take a certain thing, you take treatment at the doctor. Tell me how I quit cigarette. Jatin, you are a student and you are smoking. How long have you smoked? Jatin, how long have you been smoking? How long have you been smoking, Jatin? Jatin is a funny character here. A medical student smoking, and you know the effects of smoke of cigarette. Free radicals, cancer, my friend. Please stop smoking. Force yourself to stop smoking. Force yourself to stop smoking. Yes, Hubs 5851. Avoid alcohol and drugs. Stress management is very important. And you know the benefits of doing this. The benefits of doing this is reduce relapse. It reduces relapse, improves coping skills, and encourages early help seeking. So if you are here and you are watching me, and you know someone who is bipolar, psychoeducation is very important because it makes these people to know when to do or what to do, or when to start an action. Understanding symptoms, identifying triggers, importance of treatment adherence, avoiding alcohol and drugs and stress management is very important. Reduces relapse, improves coping skills, and encourages early help. You see? So, my guys, it is very important to... Just a minute. It is very important to follow this that I'm saying. It is important so that you cannot. Hi guys, Betty is here. Hi Betty. Hope you are doing good. It's a Friday evening right now here in Kenya. What about where you are? Hope you are doing good. Betty's world. We are talking about managing bipolar without drugs. Just imagine. And we have said, understand the symptoms of mania and depression. Identify the triggers and warning signs. Improve alcohol and drugs. Stress management, very important. Reduce relapse, improve coping skills, and encourage early help seeking. Sir, I have stress of make money. But Jatin, you are English and you are a medical student. You are English. Jatin, Jatin, you are a student. Learn how to work hard. You pass your exams fast. Psychotherapy. Let's talk about psychotherapy. Now, the first step when you want not to use drugs in bipolar is psychoeducation. Teach what to do. Teach people what to do. You get? Teach the people what to do. And then you go and do what? Psychotherapy. After teaching the people, understanding their symptom, identifying the triggers, importance of adherence to drugs, avoiding alcohol and stress management. Now you expose these people to something that is called psychotherapy, talking therapy, talking like how I'm talking here. Yeah? And people are saying I'm really talkative doctor, a talkative doctor. Recognize negative thoughts. Always recognize negative thoughts. Change harmful behaviors. There are behaviors that are not good. There are some behaviors that are harmful. You change harmful behaviors. Manage depressive symptoms. And here we are not talking about a normal person. Here we are talking about a person who has bipolar. We are talking about a person who has bipolar. You get? You recognize negative thoughts that the person has, because there are so many people who have negative thoughts in their minds. Change harmful behaviors. Improve problem solving. Sir, I have to go. Okay, Jatin, no problem, Jatin. Go and study for your exam. Manage depression symptoms. Useful, especially during depressive phase. During depressive phase, you can always manage the symptoms. Interpersonal and rhythm therapy. Interpersonal and social rhythm therapy. Interpersonal means just me and you. You get? Just me and you. How we are relating. Interpersonal. Maintain regular daily routines. The other one is stable sleep patterns. You should have stable sleep patterns. Not patterns that are you are sleeping 2 hours, you are up. Tomorrow you are sleeping 6 hours, you are down. No, stable sleeping pattern, regulated sleeping pattern. Healthy relationships. Don't find yourself, you are bipolar, and you are into unhealthy relationships that everyone wants to fight every time. That is not good. Stable sleeping patterns. Mercy Grace, I see Mercy Grace here. Long time Mercy Grace. I've been so tight at times, even don't catch her. Oh, Roberta Ramos is here. Roberta, there was a question that someone asked, which course are you doing? Welcome everyone. Mercy Grace and Roberta is back. So we are talking about maintaining sleep. Oh, El Marie. Sorry, my phone turned off. El Marie, how is you? How are you doing, El Marie? Hope where you are doing good and great. Here, today I'm just speaking about how to deal with bipolar. How to deal with bipolar without taking medication. Today no medication. Today we are just talking about bipolar with no medication. But I started by us answering a question on metformin. So let's talk of interpersonal and social rhythm therapy. Interpersonal and social rhythm therapy. Maintain regular daily routines. Stable sleep patterns. You don't just sleep. You should have stable sleep patterns. Healthy relationships. People outside here, did I miss something important? Yes, you missed something important, like cognitive behavioral therapy, psychotherapy. Roberta Ramos. If you have a friend, Roberta, who has bipolar, if you have, or you have noticed, you have a friend who is very aggressive, and sometimes is always above emotions, you should come to talk about bipolar. But when you want to help that friend of yours without using drugs, now start talking about, recognize negative thoughts, change harmful behaviors, improve problem-solving skills and manage depressive thoughts. Or if you know yourself you are bipolar, you should do the first one was to identify psychoeducation to the people or to the person. Or if you are you have to get that education. You have to get that education so that you know. And we said the first one, psychoeducation, is understanding symptoms of mania and depression. The other one is identifying triggers and warning signs and importance of treatment adherence. Avoid alcohol and drugs. That is Roberta from Ohio. Roberta, do you have a channel? Or let me check. No, nowadays, like most of the people I meet are. Oh, I see Roberta likes Zumba. Roberta likes watching Zumba. Roberta, I've seen you like dance fitness with Jessica. I see you like Zumba. Abina is here. Abina, hi. Jatin went to check on someone. I know he'll be here. He wanted to talk to you, but you said that you went to take some water. Abina, how is the day where you are? Hope you are doing good. Today we are talking about treatment of bipolar without medication. We are treating bipolar without medication. Okay, now let's talk about understanding symptoms of mania, that is psychoeducation, importance of treatment adherence, and stress management. Alcohol is a very bad thing because alcohol brings so many problems. The first thing, alcohol brings confusion to relationships. It brings health immunity issues. And then when you have something like bipolar, it gives you psychosis because, yeah, I had to use the bathroom. Okay, thank you, Roberta. Alcohol, when you take it, it makes you to hallucinate. After hallucinating, you start having features of psychosis. And you know, psychosis is the normal word you understand is, you understand the normal word. Okay, so after psychoeducation, you give the therapy. The therapy is recognizing negative thoughts, change harmful behaviors, improve problem-solving solutions, manage depressive symptoms. Usually, it's a... Let me check this. Oh, I'm supposed to post something. Okay, I'm supposed to post something and I had forgotten. Let me post it. So guys, if you have any question, so is he gone? He is here, but he's going to pick something. He wanted to know about you, and he was saying that he wants to have an international friend like you. So at Ohio, Roberta, what do you do? What do you do? He's a good guy. He's from India. Roberta is from India. He's from India. So we are talking about things concerning bipolar management without drugs, because so many people are having problems of management. Greetings, Dr. Benjamin. Sorry, I am late. I had visitors. No worries. We understand. We are, adults have so many things. Smiler in the city. Today we have a new guest that is called Roberta Ramos from Ohio. Roberta Ramos from Ohio. Just imagine. I don't really do much. Oh, okay. So Roberta Ramos, interact with the people. And today I was watching a video of Smiler in the city. I love flowers, and I saw Smiler taking us through a very nice place that is called Tulips Gardens. Hey, flowers! Please, Smiler, give us more of those videos. They are soothing, and I feel nice when I see beautiful flowers. The only problem is I cannot import the flowers from there to here. I have to talk to Jamaican uncle. I have to talk to Jamaican uncle. Now, Nana, I hope one day Smile in the City, as Jamaican uncle is coming, will come along. Like how we were with Ridley last time. Some good combination. Eating buffets. And I told Ridley to drive, and Ridley told me, no, I cannot drive here. So congested. You see. You see. Now, let's continue how to manage. Bipolar conditions with how to manage bipolar conditions with without drugs. So the new people that are coming in, thank you so much for logging in. You are blessed. Thank you so much. Oh, someone is asking me a very important question. Let me answer them, please. Okay. If you are you a doctor? Yes, Roberta, I'm a doctor. I'm a doctor from Kenya, Africa. I'm a doctor from Africa, and I love everyone. I love friends. I love making friends. Just like Jatin said, here we love socializing. And he'll be back. Jatin is a very nice person. I know he'll be back. Now, psychotherapy. Let's talk of psychotherapy. Recognize negative thoughts, change harmful behaviors, improve problem-solving skills. Thanks, Roberta. Thank you so much. That's why I'm here, to meet people like you. And Roberta, share this channel to your friends too. Invite your friends. Let's have a talk with your friends for mental health. Let's interact. Bring your friends aboard. Share them the link. Tell them, come and hear this doctor how he's talking. We are talking about psychotherapy, how to solve bipolar issues, and we have reached at psychotherapy, talking therapy. When you hear psychotherapy, you must know that it is talking therapy. Psycho is talking therapy. You have to recognize negative thoughts, change harmful behaviors, improve problem-solving skills, and manage depressive symptoms. Always manage depressive. They are not online. No, you just send the link and tell them they'll come later to watch videos. It's okay. Don't worry, Roberta. You see, when you hear anywhere we are saying talk psychotherapy, we are meaning talking therapy. Talking and helping people to relate. Talking and helping people to remember things and to relate. Talking therapy. Recognize negative thoughts, change harmful behaviors, improve problem-solving skills, and manage depressive symptoms. Very important. Very important. So if you have any question about these things that I'm talking, please ask me. You see, please ask me, because it's very important. It's very important that we help each other. So let's talk about psychotherapy. Talking therapy helps to recognize negative thoughts, change harmful behaviors, and improve problem-solving skills, and manage depressive symptoms. Depressive symptoms are like withdrawing from what you are doing and doing some other things. Depressive symptoms. Okay, Roberta. Okay, you can watch later when you are free, and be free to ask me anything that you would like. which is medical. I will like to help you, and there are so many people that are here too will like to help you. Now, interpersonal and social rhythm therapy. Interpersonal and social rhythm therapy. The first one was CBT, cognitive behavioral therapy. These are psychotherapies. And the second one B is interpersonal social rhythm therapy. Interpersonal social rhythm therapy focuses on maintaining regular daily routines. Maintaining regular daily routines, staple patterns, and healthy relationships. Irregular sleep or triggers mania, so it's very important. Routine is very important. You understand that? Routine is very important. Family therapy. Let's talk about family therapy. What do we know about family therapy? You know, there are some things that are family, and you have a person in your family that is bipolar. This person needs compassion. This person needs to be brought close. This person needs his people or her people, the family. You get it? So that even the spirit of mania, the feeling of mania goes down. You know, when you are around people and you know these people love you and they are taking care of you, they are always there for you. You know what happens? People feel that you are the best. So you calm down. You calm down. So the symptoms that do not come out so much. These ones, they do what? The family therapy, what they do, they reduce conflicts, improve communication, and support medical adherence. They do support medical adherence. You get? Very important. They support medical adherence. Because if you are loving to your person and is undergoing something, you will always take advice from them. So something is always popping up here and it's irritating me. Let me remove it. So you understand these things, my friends, my people. These things are love, support to a person that has a problem, support to a person that you feel this person needs help. You get? Improving communication, adherence to medication, and detect early signs when you are around your family. And also, it reduces conflict. Let's talk about supportive therapy. Supportive therapy. This is therapy that it provides emotional support, encouragement. Supportive therapy, encouragement to this person that has a problem. Guidance during stressful situations. It's very important, my guys. Very important. It's very important for the guidance during stressful situations. Lifestyle modifications. You know, lifestyle modifications. How do we modify lifestyle? How do we modify lifestyle, and how do we make our lifestyle be well with what is going on when one is bipolar? You see, when one is bipolar, how do we make sure that we support this person? Lifestyle modification. You talk to your person, or you personally, if you have bipolar, you start having the change for yourself. Poor sleep may trigger mania. Good sleep may reduce the stress on your brain. So the aggressiveness goes away. So you are well. You get? Advice include, let's see, about sleep hygiene. You know, here it is lifestyle modification. Let's see what advice will do. Sleep at the time daily. If it is 9 p.m., sleep at 9 p.m. Sleep good 8 hours until you wake up. It regulates the neurotransmitters in your brain. It makes them to have a clock so that you cannot have a problem. You get? Avoid caffeine at late night. And you know, if you are taking caffeine and you are on a medication, what may happen? You may have a problem in absorption of some drugs and even some components of food. So I usually tell people caffeine in the morning, don't take caffeine at night. For those people that are always liking to take caffeine at night after eating food, that is wrong. It is interfering with your normal clock of the body, the brain, the normal clock of the brain. Let's talk about limited screen time before you sleep. Limited screen time before you sleep. Very important. Nowadays, our children are on screens 24 hours. The creativity of handworks and so they don't know. It is important to regulate the sleep time for your children, because you have seen most bipolar complications are got at the ages of 15 years to 20. So it may have started from the time this child was always watching TV continuously, having problems with neurotransmitters in your brain. You get? Does bipolar give you suicidal thoughts? Yes, yes, Smiler in the City. Yesterday, this is a question of Smiler in the City. Does bipolar give you suicidal thoughts? When a person is, we have how many types of bipolar? 3. The first one is mania, the second one is hypomania, and the third one is cyclothamia. So the people who get suicidal thoughts are the manic, the ones that are aggressive, wanting to fight everyone, talking so much, and you know, when they are doing that, the neurotransmitters become imbalanced. So when they come imbalanced, what happens? You start hallucinating, and when you are hallucinating and becoming delusional, what happens? You start having suicidal thoughts. So most of manic people, Jatin, Roberta was asking for you. Jatin, Roberta was asking for you, but you are not here. So when you have the manic thought and you hallucinate, suicidal thoughts kicks in. So these are the danger signs that we spoke about today. When you are seeing the danger signs, one of the danger signs that is very important when you have a person who is bipolar is suicidal thoughts and actions. So you see, Smiler in the City, that is how it happened. So we were talking about sleep hygiene, very important, limited screen time. You have seen some people and some our children and most of our ladies, mostly ladies, people saying that I am an introvert. Someone stays indoors and watches Netflix the whole weekend indoors. You'll not see this person out doing something. I am an introvert. Most of them are bipolar that have cyclothamia, between mania and hypomania. And most people that have hypomania, they call themselves introverts. It is very important to understand what I mean is of something, because when you are calling yourself an introvert, have you seen a psychiatrist? Do you know your personality? Do you know the personality disorder that you have? This is very important thing when we are talking about these issues. So sleeping time, avoid caffeine at night, and long screen time is very important. Regular exercises. Let's talk about regular exercises. Benefits of regular exercises. It improves mood, reduces stress and anxiety, helps sleep. Example, Walking. Barry walking exercise. Let's walk, guys. When he's walking, Barry walking exercise, walking, and saying, let's walk, guys. This is a healthy walk. This is a healthy thing to do when you are walking. Barry walking exercise is telling people, please walk. It's a good exercise so that you can improve your body. You see that? Jogging, swimming, and yoga. These are very important practices when it comes to someone's life. Let's talk of healthy diets. Healthy diets are very important. Encourage balanced diet, adequate hydration, limited sugary foods and caffeine. Limited sugary foods and caffeine. Very important. Avoid alcohol and substance abuse. Those people who take alcohol every day, please listen to yourself. Avoid alcohol and substance abuse. I've always talked about alcohol here. Always talked about alcohol. Alcohol and drugs can trigger mood episodes to a person who has bipolar, worsening symptoms, and interfere with the treatment. Yes, because absorption of drug and interaction is a bad thing. Now, stress management. Stress commonly triggers relapse. Methods, relaxation techniques, mediation, deep breathing exercise, time management, and counseling. Time management and counseling. Social support. What are the social supports that these people need? If you have a question and you are listening to me, my friends, don't keep silent. Ask me. Let's interact at the chat. Sometimes when you talk and you are seeing people are listening and they are not interacting, maybe they are bored. Or it is very interesting, they don't want to intervene. So which is which? Am I boring? My guys. Today is a Friday. Rich Sue said hi. Hi, Rich. Hope you are good and the blessings of God are within you. Rich Sue. Hope you are good and the blessings of God are within you. God's blessings are the best. Because they know the right time to hit and they know the right time to be showered. So welcome, Ritsu, as we talk about how to solve bipolar issues without doing what? Not boring, we are learning. Thanks, Smiler in the city. And please, Smiler, continue giving us those videos. I love flowers. I really love flowers. So when you are hey dog, I'm good. Thanks, Rich. When I saw you going through the tulips garden, I felt so nice. It was a wonderful video. And next time, do it long. Let it be a bit longer. When you are in flowers, please make it a bit longer. We enjoy the scene. Now, social support from families, friends, peer groups. I've talked about it. Community organizations. This reduces isolation and improves recovery. Occupational and rehabilitation. Occupation and rehabilitation. You see, occupation and rehabilitation. Very nice. Very important. Because these people that are bipolar, they should be doing something, even if they are bipolar. So they should go to work, they should go to school, they should get a skill and regain independence. You don't keep these people at home because you you think they can't do anything. No, it's important. They do a skill. And you have seen so many people that are bipolar that are working into institutions and they are taking drugs and they are doing good. Very nice. So guys that are coming in, if you have forgotten to like, check if you have liked the channel, if you have subscribed to the channel. That is very important. They should work. These people should work. Know that we really enjoy these sessions. Masterclass. Yes. Masterclass. Very important. Rich, when you are helping, you are talking to people on things that are important and people are appreciating. You feel so nice. You feel so nice that these people are appreciating what you are giving. You see? So, as you come in and support me by watching my videos, I just tell God to bless you. Roberta, your friend Jatin is here. Roberta, your friend is back. You see, as you watch, when you are watching, you are supporting someone. But when I'm giving you the knowledge, I feel good when you are appreciating. Just double tap the screen to like. Let's support Dr. Benjamin. Smiler, please plan. Please plan when Uncle is coming back. One day you come back with Uncle. It will be a very good combination. Just imagine me, you, and Uncle. Hey, me, I'm traveling next year, not this year. So after next year, you can hit me where you are. One day you see me calling you, Smiler, I'm around your range and I'm passing. Can I say hi? Routine monitoring and follow-up. Number 7. The people, after they have gone to improve their social skill, they have improved how to earn some money and they are bipolar because of psychotherapy and social therapy. What do they need? Routine monitoring. These are not just people you can leave them. They are not just people you can leave them. Oh, Jatin, you are here. Roberta is here too. You are looking for Roberta. Now you can talk as you listen to me. Roberta, your friend is here. Now you can talk. You detect early relapse so that a person who has mania, so that you cannot go aggressive. You see, monitor functioning. How is this person functioning? Is he just, or is she just going normal, or the relapse is around the corner? The relapse can come around the corner and messes out everything. You have been managing someone so good. This person relapses, harms himself, and then you start. So monitoring is important. Even not harming himself, harming even the other person. Harming even the other person. So let's get into knowing these things, my friends. Let's get into interaction. You can save a friend. You can save a person's child. You can save yourself. You get. We have seen people that have into a relationship. In Kenya here, there are people that have been in relationships. They are students of higher learning in universities. And the problem comes, you find them fighting at times and they kill each other. And when you have sent your child to college or university, sometimes this child is alone. Sometimes this child doesn't have someone to follow up and to know that this child needs this at this time, this child is bipolar. And some students go to school of higher learning without telling other people that I am bipolar and I'm on this medication. So because this person is handsome and beautiful and they are in the state of relationship and knowing each other, just like our friends that are here, like Jatin and Roberta, how they are taking notes, exchanging and becoming friends, you find they are fallen in love. So one day the bipolar one decides to be manic episode comes, and then the other one doesn't know my friend who I'm in love with is bipolar in mania category. Things bad happen. They fight, takes a knife, does whatever they do. So it is good to be following up. And also, if you are bipolar and diagnosed, tell your partner that I am diagnosed with bipolar. Very important. Reinforce coping strategies. Try to tell these people that this is how you can cope up with this problem. This is how you can continue with this problem. There is something that is called electroconvulsive therapy. When someone is totally depressed, in severe depression, you give electrocutions to stimulate the brain so that this person does not get convulsions. You get? Severe mania not responding to treatment can be so bad. It is given. We give you some shocks to stimulate the brain. When you are not responding to any drug, when you are not responding to psychotherapy, you see. And then there is another good thing. There is another good thing that is called catatonia. Catatonia, this is a common. Catatonia is something that is when you are having a bipolar that may help. Serious neuropsychiatric syndrome characterized by abnormal behaviors. Someone just having abnormal behaviors. Imagine. So those ones are under electroconvulsive therapy. If you see someone is heading that way and it's not doing good, we do electroconvulsive therapy. We electrocute to restart the neurotransmitters and the brain sensation and the brain transmission. Check. Welcome everyone. I can see you guys here, very curious and listening silently and watching Benjamin the Wise Guy. If you have any question, the chat is open. Please just ask as we continue to finish. So that is the things that we can do. That is the thing we can do. Let me, there is something here I want to. You see, do you have a dog? Roberta likes dogs. Roberta loves dogs. Roberta loves dogs. I don't have a dog. I'm a very busy person. Dr. Ben doesn't have a dog as a pet. Yes, Jatin asked me that yesterday. Okay. So when you have a problem, your bipolar is becoming worse, and you are having severe depression or hypomania or suicidal thoughts or severe mania not responding to treatment or catatonia, problems with the neurochemicals and development in your brain, what we do is we give you an electroconvulsive therapy with some stimulations of electrons. Early warning signs of relapse. Early warning signs of relapse. Mania warnings. Reduced needs for sleep. Excessive talking. Increased energy, irritability, and risky behaviors. We talked about the risky behaviors. Driving recklessly. When you are in a train, you want to hang on the train and shouting. Sexual, but you are involved in bad sexual habits. Those are bad things when you are bipolar. there are bad sexual habits, and bad practices. I have a dog and a bird. Okay, which type of a bird do you have, Roberta? So irritability, risky behaviors, increase in energy, and there is those are for mania, excessive energy, and so depression warnings: sadness, fatigue, loss of interest, poor concentration, and sleep changes. Is very important. Now let's talk about, today was a very short session, and if you have a question you can ask it now. If you have a question you can have it now. Let's talk about some questions that you have. If you are listening and you have a question, please let's have the question now, because I'm just about to finish. He is very nice. Thank you, Roberta. Now, it's very important when we ask questions, they help. But if you have understood so well, so nice. I thank you, everyone, for understanding my sessions. I think you, the new people like Jatin and Roberta, are really sharing my videos. I have a friend from who came to the chats from India. This friend shared my video in their WhatsApp group of school, and every student that was in that class subscribed, and they are watching my videos. So if you have friends that you are having, the students like Roberta, if you have friends that are watching, if you have friends that are good, you can share the videos, tell them to come and subscribe. Students, you are under examinations, and listening to me may help you to remember some things. So as we finish, let's talk about prevent relapse of bipolar. How to prevent relapse of bipolar? How do you prevent relapse? You see, how do you prevent relapse of bipolar? How do you prevent relapse of bipolar? It is very important, because someone can just be okay. Agnes Thomas, greetings. Welcome to the chat, to Agnes. Betty is still here. Thanks so much for being here. This is bipolar, and we are ending bipolar today, because weekends we do random talks and questions. So how do we prevent relapse of bipolar? Who knows? Because we have talked about very many issues, and all those issues are surrounding a person who is bipolar. So prevention is to give, what animal do you like to have as a pet? Peacocks. Roberta, I would like to have a peacock and some birds. I love birds. I love birds. Now, medication adherence is very important, and psychoeducation. Yes, Jatin, parrots. Where do we get parrots? I would love to keep some parrots, but I've been told parrots are more in South America. That is, and the Amazon, Asian places. Now, to prevent, we are on preventing relapses. This one are like adherence to medication. There are people who have birds. No, I don't love birds. Psychoeducation, recognizing early signs. The ones that you recognize early signs, like reduced sleep, exercise energy, excessive energy, irritability, increased talking, overspending. If you notice your friend or someone in your household is spending a lot than normal, start thinking about it. Risky behavior, sadness, fatigue, sleep changes, lost interest and poor concentration. Start to check on those. Yes, Jatin, bats are not good. In our society, where I come from, bats are a sign of bad omen. Bats and owls. I don't know why they have bats. Bats and owls. In my society, bats and owls are a sign of bad omen. Imagine if at my village, if an owl comes to your compound, you have to call people to beat it up. Everyone to beat it. It's a sign of sending away bad omen, and they burn it. It owls look like some cats, flying cats. We call them flying cats. You give regular sleep pattern, you reduce stress reduction, avoid alcohol and drugs, and regular follow-up and family support. Remember, healthy lifestyle, cognitive behavior therapy, and intersocial and social rhythm and monitoring triggers is very important. But social suicide prevention, early recognition of depression symptoms, family supervision, early depressed, emergency attention, and emergency medical attention. It's very important. And you manage other things that are related to bipolar, anxiety disorders, substance disorders, and mental illness like psychosis and schizophrenia, mood changes pattern, sleep, medication, stress, all of them. Let's talk about improving quality of life. This is non-pharmacological. Promote treatment adherence, reduce hospitalization, improve relationship and social functioning. It's very important when you do all that. You see, guys, when it comes to Dr. Ben, I went on vacation and came late there. I cried for days. A parrot. Agnes, I'm really searching where I can buy a parrot. My daughter always tells me she needs a parrot. A parrot in Kenya, getting parrots is a big deal. It's a big deal buying parrots in Kenya. So, my guys, that is non-pharmacological prevention of bipolar disorders. I see we have new friends that have joined us, and if I'm giving like how many minutes, let's give like 10 minutes. If anyone has any question, can ask. Agnes, that was a parrot. Where did you buy it? In the stores, or you had them at home? To find some parrots and some they're called what? I want to find some parrots and these others that are called peacocks for my compound. Peacocks for my compound. So Roberta, please copy paste this channel. Bring your friends to the channel, like Jatin. Jatin told me she's bring a friend to the channel. I will find out for you. I had birds. Oh, okay. That Roberta Ramos had have friends. Jatin have friends. Jatin has brought some friends to the channel, and it is good. You know, here in Kenya right now, it is you can only get in stores. Oh, okay. In Kenya, I don't know where I can buy them. Some things getting, you know, there are some things that are got in the Asian community. Some things are got in the American community and the British community. So bringing them to Kenya, you need some licenses. You need some licenses that you deserve so that they can come in. If you don't have those licenses, you cannot get in with them. Birds, they live in the jungle. Yes, birds live in the jungle. So my friends have answered that question. Next week we'll see which topic we can start with. We will see which topic we can start with, and let's get to encourage everyone to live a healthy life. Encourage our young children to live a healthy life. Let's encourage everyone to live a healthy life. Both physically, what we eat and what we do, and mental health. Susan Mwenda, healthy life is everything. I miss Susan Mwende. I miss Mwende. I miss you. You went out of the group and I felt bad. I will bring you back to the group. Healthy living is very important, and it gives you, when your mind is at peace, when your mind is at peace and you are feeling relaxed and you are feeling like everything is okay, you feel, oh, thanks a lot, Susan. You feel that life is good, and it's very important. Family, let's give this video a like, please. Your talk sells my health journey. Thanks a lot, Susan Love. Change your channel name to Susan Love, because you are a lovely lady, Susan Love, and Mwende means love. So you say Susan Love, and then you, in brackets, you put Mwende. Hey, Roberta Ramos had a spider. Maureen Kawila, long time. How is you going through, Maureen? Roberta, you had a spider. Hey, here, if you own a spider, people will run away from you. So, at most, when you have the other one that is called tarantulas, people will run away from you, my friend. Hey, So, I was talking about mental health. The best way to have a good mental health is to listen more, talk less, and be slow in action. You understand? It's like driving. Listen more, talk less, and put a brake on actions. Putting a brake on action means you think first before you do anything. You get? You think first before you do anything. So the drugs that we use in bipolar situations, Robert, smile in the city. When we are online, we are looking at the world. Now, when we are at the chat, we are looking at the world. So, Smiler, you will hear everything, but just listen, because maybe in their society, having a spider is a good thing. I fear spiders. I once saw the big spider that is called tarantulas. It is called Roberta. Hope that is not what you have. The tarantula. It's a very big, ugly spider. That one, if it bites you, some few hours ago can be gone. Tarantulas, but I can see some people play with it so much. So, guys that are watching, my friends, it's the spider. Yes, Aya, Jatin has a lizard. Yeah. Susie, listen to my people here from India and Ohio. Susie. Hey, when you come online and you are on live, sometimes you forget even the topic of the day. You start having some new physical and funny issues. Now, Jatin from India has a lizard, and our friend from Ohio has a spider. Those are the pets, my friend. Pets. Hey, I'm late. Got held up, really wanted to follow the live. I will rewatch. No problem, Hajways. We have just talked about non-pharmacological issues, ways of solving bipolar. But some things have come on. Pets. Weird pets. What do you say about that, my friends? Hey, Susie. Let me just laugh. Susie, today you have decided to give me something. Thanks. May you be blessed where you are, Susie. May you be blessed with that. Oh, I forgot to close his door. Oh, and then it went away. Susan, are you following us the way I'm following? Even Smiler in the city is laughing. Smiler. Smiler, which pet do you have? Do you have a dog? Let me see. Hey, today I'm hearing it. Now I have him on my hand. You are holding, Roberta, you are holding a spider. Or what am I seeing? Roberta is holding a spider. I don't want, there is a condition that is there in medical field. Weird pets. Here people even have mice, snakes, birds, some insects, and some actual exotic. So on and so forth. In my community, my friends, where I come from, if you are having a snake, no one can come to your house, to your compound, or no one can speak to you because they know you are flying with a broomstick. At night, you are the one who is flying with a broomstick. And you know people that fly with broomsticks. You understand? Hey. But I've visited some people that have cheetahs. I've visited some people that have, in Kenya, when you are an influential person. When I was young, I had an albino mice. Yeah, that is nice. Albino mice. Hey, guys, you are making me feel nice. You are making me feel nice. Listen, where I come from, if you put some things like these ones, they are related to some juju. We call them juju. I don't want teeny spiders, so break the egg. Dr. Ben, in Kenya, someone has cheetah as pet. Yes. If you are influential and you have money, there are some even who have lions as pets here in Kenya. So if you have money and you want to keep a pet like a lion, you see, I said it, but some are actually very cute. Oh, you can go to the Kenya Wildlife Services, you get a permit. You get a permit because that is a wildlife. It is not for domestic keeping. So when you have that permit, you are given the regulations of how to keep that, and they will come and see. They will come and see how you have kept them. They will come and see how those regulations that I have said, because you can't keep a lion and you don't have enough security. You can't feed it at first time. You get it will show speed as a rhino, or what was it? I've not seen it. I will find out what show speed is keeping. If you don't have money, you can't, or finances, I have a huntsman. Oh, if you don't have money, you can't keep an exotic thing like a lion or a giraffe. Imagine having in your compound a giraffe. You mean you should have a very big compound with enough trees, enough vegetations. And some people have them here in Kenya. I've seen some politicians that are keeping giraffes in their compound because they have a huge compound with some good trees that giraffes can sit on. Smiler in the city, where did the albino mice go? Hey, today you are making me, you have made me to Elizabeth. Hey, Habs, hi. Habs, Habs and Eliza, welcome to the channel. forgot the topic of the day. People are keeping weird things here. Hey. And maybe in their society is not weird. You get? Maybe a mice that is albino. Hey, hey, hey. Maybe in their society it is not albino. You get? It is not weird. But in my society, hey, the elders, I'm answering something. You see, at my village, when you keep something like a cheetah, even if you have the license, squirrels are cute pets. Yes, my friend gave me only one mice, and after 1 week I had 12. Wow! But I had a smile in the city. I heard that some people who eat mice. Yes, so prayers will be brought there. Susan, I understand your place is like my place. The village elders will come to pray for that family because they see that there is a problem here. Those babies are demons. I'm feeling drained. What to take as a woman? Habs, why are you feeling drained? What is up? What is the time where you are right now? Yes, Hajiways, they come and they pray and they sprinkle some things and they shout out. It's like they are taking away the bad omen. You cannot go to my village and have a snake. But I've seen some people in their cultures, keeping snakes is a normal thing. I remember there is here is Elizabeth. I don't know if anyone is here from the Luo community. And there is a community in our country that is called the Luo community. A long time ago, they had in their community a place called Kisumu, a very big snake. A very big snake like anaconda. You leave alone what anaconda you see in videos. So this snake was, they were respecting it because it was found, that species was found in their area alone. So the people used to go to see it in the bushes. You see, it's crazy how cultures make society different. Keeping a python here is not a problem as long as it is in the safe place. Wow! Listen to that. Yeah, Hajiways, where are you? Which country are you at? In Jamaica? Hajiways, are you in Jamaica? So, this snake, when it died, people cried. Long time ago, we were even, I think we were not born that time. We were getting stories, but we still see it mummified in the museum. That snake is mummified in the museum. People cried because they knew it is the only species they have and it is giving them blessings because tourists are coming to see the only bigger snake in Kenya that is in their community and they used to pray for it. So when it died, they mummified it and it was given to as a cultural heritage. It was given to the museum in Kisumu, where that community is. So people go to see it. So if you are living in Kenya in Kisumu and you have not seen that snake, you know the snake that I'm talking about? Yes, is it the Omieri snake? Oh yes, that one. Hajiways, so you have heard about that story, eh? Omweri. Omweri was bigger than anaconda, my friend. You saw it in the National Museum. Now, Hajiways, let me tell you, that snake that you saw mummified, when it was alive, I hope, did you see the real pictures? That thing was big. Robert, I think you are telling story on Wednesday. That thing was big. Let me tell you, Omweri was a big. So Hajiways has been in Kisumu and saw it. It was mummified and preserved there. So in the other countries, keeping some things like the ones that I'm listening, seeing some people are keeping, sometimes I feel it's normal because it's their society. I have seen the real images. Oh, okay. There was an image, I don't know if it was removed in the museum. The size of the snake and the size of the width in the wall was created so that people can see how long it was and how big it was. I don't know if you saw that one, because that one was the real picture. But Omweri had, there was a time it was brought to the capital city to be preserved there, and people brought so many problems. So it had to be returned to the community where the museum is of the community. You see? So that is it, my friends. Thank you a lot for tuning to my channel. And I usually say that when you are in my channel, let's interact. Tell me any topic that you want me to talk about next. Interact with me. Tell me what you feel we can improve. Tell me what you feel. If one day you want me to talk about, the only thing I cannot do, I cannot bring a real, like a patient on the screen when I'm in hospital. Confidential issues are confidential. Maybe a person who is in sane mind and has agreed to talk on camera about the condition, that one I can do. And it's not based on a movie. No, it's not a movie, Roberto. That is a real story. It's a real story. Our fathers used to go and see the snake, but it died because of old age. So, my friends, I think time has come to end. Let's meet tomorrow at 4:30. Or anyone who has any question? Anyone? Today we didn't do feel good evening. We will do it tomorrow. So 4:30 tomorrow we will talk about general talks, and then at night at 9, the time that we always do, it's time for jumping up and feeling some music. So be close, be here every time so that we can interact. Bye. See you guys. Roberta and Jatin, big up always. Smile in the city. Everyone who has logged in, I thank you for coming in. Let's meet tomorrow. And Roberta, please share this to your friend. Share this to your friends. Tell them you have a good channel where we interact and talk and get more friends. Okay. Bye. See you guys. See you.